Let's chat.
Just ignore that. Ignore all of them. How y'all doing? Dr. Michael Hernandez is joining us from Chattanooga Dental Care. Dr. Hernandez, good to see you.
Good to see you.
One thing we're hearing more and more about these days are dental implants. A couple of the myths we're going to knock out of the way, and that's dental implants used to be thought of as something just for older patients, but that's not true.
No, that's not true. Dental implants can be good for almost anybody. What we would do is set you up with an appointment at our office, go over your situation,
Right.
go over your medical history, and make a plan, and then see about getting you appointed back to start any dental implant procedure.
How do you know if implants are right for a particular patient?
So implants are used to replace missing teeth or to help retain denture. So if you're not missing any teeth, then implants won't be for you.
Right.
But the appointment's really important because everyone's a unique case, and we go over your case and
Sure.
make a plan for you.
Walk us through kind of step by step in what's involved in the implant procedure once you determine that that's the appropriate treatment course for a patient.
Right. So we would need to take a 3D scan. We plan the implant placement beforehand. On the day of the procedure, we anesthetize the patient so they don't feel anything. We place the implant into the jawbone, and that needs to heal for some time. And then we talk about future appointments for future treatment.
How long are you talking about for the implant itself to heal once it's inserted into the bone? And I guess that kind of varies from patient to patient as well.
It can vary. Full healing times range between 3 and 4 months. But typically, if it's in a front tooth, there'll be something there to replace it for the meantime.
And what do we do after that?
So after that healing period, usually a permanent crown or a permanent bridge is placed, or a denture is attached to the implants in order to help retain the denture.
And once these implants are in, they're in for life, correct?
That's right. That's right. As long as there are no complications and the success rate for implants are in the high 90% rate,
Wow.
there should be no problem. They should be in there for life.
And I've seen a number of these. When you look at a patient's mouth that's had these implants, it's virtually undetectable from the other teeth.
Yes, implants are great. They're in modern dentistry what we have to replace a tooth. It's the most tooth-like replacement that we have.
All right. I understand you've got a big event going on tomorrow at your office.
Correct. Tomorrow.
Tell me about it.
Tomorrow at 6 o'clock, we're having a free seminar open to the public. We're going to go over some of this information and go into a little bit more depth in some of the questions that we've been having about dental implants.
It's pretty amazing. You said that your success rate on implants was in the high 90s.
Yes.
What would cause somebody to be in that other small percentile?
Right. For some patients who have certain medical conditions, we talk about there being an increased risk for implant failure. That's not that common.
Right.
Implants can't get cavities, but however, they are man-made, so there are a few things that can happen, but they're rare occurrences.
And it is also important to point out, even if you were not an ideal candidate for an implant, there are other ways to replace the tooth or the teeth that you've lost.
Exactly.
You guys have all the bases covered.
We've got it all covered, and that's why it's really important to make an appointment and talk to a dentist or talk to us about your specific case. And dental implants don't happen to be right for you. There's usually something else that we can do for you.
And it is not a implant place only. It's a full dental practice, just like you've grown up with. Only the technology these days in the dental field is just amazing. Dr. Hernandez, thank you so much. Tell us where you're located and how we can get in touch with you for more information.
We're at 6102 Shalford Road, and it's Suite 101. And the phone number is going to be up on the screen for you. And give us a call and let us know if you'd like to come to the seminar.
And the website is ChattanoogaDentalCare.com. Again, ChattanoogaDentalCare.com. We're back with more of Let's Chat coming up right after this.